In this video I will discuss the neurogenic tumors of neck. The most important is paraganglioma, carotid body tumor. This is a rare tumor that has a higher incidence in areas where people live at high altitudes because of chronic hypoxia leading to carotid body hyperplasia. The tumor is most commonly present in the fifth decade. Approximately 10% of patients have a family history, with familial cases caused by mutations in the genes for succinate dehydrogenase (SDH) enzyme. There is an association with pheochromocytoma in familial cases, and thus appropriate tests should be undertaken to rule out synchronous catecholamine-secreting tumors during the glossopharyngeal nerve, carotid body's vagus nerve, aorticopulmonary bodies, tympanic bodies, ganglion nodosum glomus jugulare, internal jugular vein, pulmonary artery. Sites for chemodectomas. Workup. The tumors arise from the chemoreceptor cells on the medial side of the carotid bulb and, at this point, the tumor is adherent to the carotid wall. These tumors are usually benign with only a small number of cases producing proven metastases. Clinical features. There is often a long history of a slowly enlarging, painless lump at the carotid bifurcation. About 1/3 of patients present with a pharyngeal mass that pushes the tonsil medially and anteriorly. The mass is firm, rubbery, pulsatile, mobile from side to side but not up and down, and can sometimes be emptied by firm pressure, after which it slowly refills in a pulsatile manner. A bruit may also be present. Swellings in the parapharyngeal space, which often displace the tonsil medially, should not be biopsied from within the mouth. Investigations. When a paraganglioma is suspected, a carotid angiogram can be carried out to demonstrate the carotid bifurcation, which is usually splayed, and a blush, which outlines the tumor vessels. MRI scanning also provides excellent detail in most cases. This tumor must not be biopsied, and fine needle aspiration is also contraindicated. Treatment. The Chamblin classification is used to determine the surgical resectability of these tumors. Type 1 tumors are localized and do not involve more than 180 degrees of the carotid vessels. Type 2 tumors surround the vessel by over 180 degrees, and type 3 tumors completely encase the vessels and are more challenging to resect, with higher complications and a possible need for vessel reconstruction. Because these tumors rarely metastasize and their overall rate of growth is slow, the need for surgical removal must be considered carefully, as complications of surgery are potentially serious. The operation is best avoided in elderly patients. Radiotherapy will not cure the tumor but can prevent further growth. In some cases it may be possible to dissect the tumor away from the carotid bifurcation, but, at times, when the tumor is large, it may not be separable from the vessels and resection will be necessary, such that all appropriate facilities should be available to establish a bypass while a vein autograft is inserted to restore arterial continuity in the carotid system. Vagal body tumors. Vagal paragangliomas arise from nests of paraganglionic tissue of the vagus nerve just below the base of the skull near the jugular foramen. They may also be found at various sites along the nerve down to the level of the carotid artery bifurcation. They also present as slowly growing and painless masses in the anterolateral aspect of the neck, and may also have a long history, commonly of 2 to 3 years, before diagnosis. They may spread into the cranial cavity. Diagnosis is confirmed by CT and MRI scanning and additional MRA or arteriography if necessary. Treatment is surgical excision following appropriate consent of resulting hoarseness. Peripheral nerve tumors. Schwannomas are solitary and encapsulated tumors attached to or surrounded by nerve, although paralysis of the associated nerve is unusual. The vagus nerve is the most common site. Neurofibromas also arise from the Schwann cell and may be part of von Recklinghausen syndrome of multiple neurofibromatosis. Multiple neurofibromatosis is an autosomal dominant, hereditary disease. The neurofibromas may be present at birth and are often multiple. Diagnosis requires CT or MRI scanning to differentiate them from other parapharyngeal tumors, but, on occasions, the diagnosis must wait until excision.